Hi everyone, I'm Steve, back here for our weekly interview with Dr. Melvin Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. One of my favorite places to go. I get all kinds of IVs and drips, and I'm a healthy person, but I was just telling him before we got on here, I'm like a kid in a candy store in there. All these different IVs, ALA and turmeric, which we're going to talk about today, and NAD and a lot of other things coming up. But today we're going to talk about turmeric. So welcome, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, so turmeric, it's something that I take orally, and it's also can be done as an IV. So um, tell me a little bit about turmeric. I mean, some benefits, and then we'll kind of get into more questions I have about different ways you can take it. But what are the benefits?
Well, Steve, first of all, this is one of the I guess a little bit one of the more confusing supplements out there in the market. For the reason that let's differentiate first what is turmeric versus curcumin. So that's kind of like which is which, right? So curcumin is the main biological active compound of turmeric. So it's part of turmeric. So again, while turmeric is the whole plant source of where you get curcumin. And curcumin gives you a yellow color to turmeric. So that's how important that is. And the name of turmeric is curcuma longa. And as you can see there, that it shows that curcumin is the main ingredient of this plant or this herb. And everybody knows that it's always present in everybody's spice cabinet, and turmeric is always there. And as we order this left and right, when we go to Indian restaurants as curry, this is always something that's there. And it's always famous for many different things. It's anti-inflammatory capacity, the musculoskeletal support that it does for the whole system, helping the joints and tissues to have less inflammation, and also helps improve flexibility and mobility, especially for the athletes that we use this on.
Hmm. Okay, so you got me interested with the athlete thing. So I know this is an IV drip that you do at the clinic there in Reno. So tell me about the IV that you do there. What's it do?
Well, basically the question, Steve, is what are the benefits of curcumin? And again, many things about the anti-inflammatory capacities of this. So that's why it's a super anti-inflammatory herb or supplement. Anyone who has pains or aches, chronic or acute, most athletes that we encounter that receives this would be the ones who have sports pain, strains from lifting, sore muscles from workouts. It also modulates different signals, again, to lower all these inflammatory markers. And also other things that we use it on as well would be to regulate liver enzymes. And there are also clinical studies out there that also it's useful for diabetes, wherein we preserve the pancreas in relation to the destruction of the body in relation to its function. And other human clinical trials that we have also is related to the different dosage and forms in relation to the forms that they used in the studies as raw herbs, and also they use standardized extracts and many vast conditions: Alzheimer's, heart disease, cancers, osteoarthritis, recurrent respiratory infections, post-op inflammations, lupus, and even HIV. And it also just shows it's one of the most potent anti-inflammatory weapon in our arsenal.
Wow, so uh, turmeric then is, I mean, a great supplement that people might want to add to their repertoire of supplements that does multiple things. So I know that you do the IV, but what about the oral?
Right.
Is that still effective? And how much should someone take? What's the
Oh, so
dosage?
that's a good question. So I get that a lot with, of course, patients who are also, I mean, we combine oral and also IV, but again, it's the most simple, I guess, to get the spice. And this is a simple application of getting the spice, add it to your food. And you can also, as I mentioned, order this in restaurant menus. But let's go back to our interventions. In oral capsules, a dose would be good enough to start with 500 to 750 milligrams twice or 3 times a day of. So now everybody needs to read the labels of their curcumins or turmerics. This has to be curcuminoids. The 500 to 750 milligrams has to be curcuminoids, meaning these are the biological active ingredients. And also, mostly it should be at 98% or in the 90%. And the most effective way to take it is with extract of black pepper, piperine, as we call it. Or I don't know if I'm pronouncing it right, but it actually improves the bioavailability and absorption of turmeric. And I usually advise it to take it with food. And everybody has to remember, curcuminoids are poorly bioavailable orally. That's why taking it by mouth, 500 milligrams, how much are you taking for that? Consider leaky gut. Consider also the bad absorption of your small intestines. 100 milligrams maybe. That's why IV bypasses the gut for 100% absorption. And studies had shown safety doses of these oral supplementations from 500 milligrams to even 1200 milligrams. But I don't want you to go that far. I'm just talking, I'm stating studies here. And one of the noticeable transient side effects that we give when we do IV, yes, you will see it also in oral if you're taking high doses, is yellow stool and even urine. So after taking it, don't think you're peeing radioactive material or you're worried that you might stain that toilet. It's all temporary and it will go away.
Wow. Well, that is great information on turmeric, popular supplement. I'm glad that we did this one and asked you about these questions because there's so many different treatments. I know the IV is always going to be better, but thank you, doctor. Great information on turmeric. That's Dr. Nario. He's at Biointegrative Health Center. I really would suggest that you, just for fun, if not anything else, go check them out online and see what kind of treatments they do. We'll try to get through all the drips that they do so you can watch it kind of get answers right from the doctor. But you can also get information there at the website at Biointegrative Health Center. So thanks for being with us, doctor.
Well, Steve, thank you again. As we all know, knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.